Just the other night, my husband and I were taking our son to the movies when he started to cry very uncharacteristically. He said that his ear hurt. He had really wanted to see this movie, so as you can imagine, he was in a lot of pain. By placing a small magnet between his fourth and fifth fingers, right underneath the joints connecting the fingers to the top of his hand, on the opposite side to his ear pain, his pain immediately resolved itself and he fell asleep within 2 minutes. He remained asleep all night without even waking up once. When he woke up in the morning and we asked him about his ear, he almost didn't know what we were talking about. All of his ear pain was gone. While this may not always be the result, this point and a few others that I'll demonstrate can help to release fluid from the area of your child's ear and to affect the pain receptors there. You can use small magnets or gold pellets to stimulate the points. I keep some in my medicine cabinet at all times. They provide an excellent way to provide pressure for an extended period of time without tiring from massage. You can also use the ball or tip of your finger to massage this area and other areas we'll discuss. If you're using magnets, leave them on your child for 10 to 15 minutes, but feel free to leave them on longer if they're providing pain relief, pressing on them periodically and removing them in a couple of hours. If you're massaging, keep massaging for 3 to 5 minutes or as long as your child will allow. A lot of earaches come on suddenly and without warning. If they last, we definitely advise you to have your medical practitioner diagnose the condition. Sometimes, though, your child's body will be able to resolve it themselves. Your job then is to provide them with comfort. Some easy techniques can give their body's own defenses some encouragement. Here are some other possibilities for stopping earache pain that I have used with success. On the outside and middle of your child's arm, between the radius and ulnar bones, approximately knuckle to tip of your child's index finger in length from your child's wrist crease, you'll find the point that we're looking for. You may feel a slight indentation here, and it may feel very tender. Tenderness is a good sign that you've found the point that may positively affect their level of pain. While I generally advise you to try this and all of these points on the opposite side to the earache. For example, if your child's earache is on the left, I would start first by pressing the points on the right. Always feel the points on both sides. If the point on the same side feels tender to your child, massage that area as well. Massage here by pressing down straight or in the direction of the wrist, or massaging in small circles. This point is also great for swollen glands. Stay here for a few minutes or for as long as it's providing relief. Then move down to your child's foot. Between the fourth and the fifth toe, just a hair's breadth to a 1/4 inch below the connection between the two toes is another great point to massage. Again, try to use these points first on the side opposite of your child's ear pain, although you can try both sides. Find, if you can, the spot that is tender. If no spot is tender, it is often helpful to massage here anyway, to direct the energy out of your child's head and down to his feet. Again, stay here 3 to 5 minutes, or as long as your child will tolerate it. These points are good points because often when your child has an earache, the area of the ear is going to be too tender to massage. If it isn't, however, I encourage you to try points in the local area of the ear, such as in front of the ear's tragus, this area here, in the depression that forms when your child opens her mouth. You can also massage the area directly above this point. For both points, I recommend a front to back motion on the side where your child's ear is causing pain. Finally, you can start where you've been massaging and move up and back, around the back of the ear, and down with firm but gentle pressure. These and other points may feel tender, which is not necessarily a bad sign. Often the tender points are just the points you're looking for. However, your child should not find the massage excruciatingly painful. Always let your child's comfort be your guide. Earaches can also sometimes result from the swelling of the adenoids or tonsils, or blockage of the eustachian tubes, tubes that connect the middle ear with the nasal passages. Lymphatic massage can help clear congestion along the entire network of vessels near the ear, and it can enhance drainage in the area. First, have your child lie down on his or her back with their heads slightly elevated. Make sure your hands are warm. Then use a generous amount of hand lotion or olive oil. Apply it to your hands and gently rub the lotion down the front and sides of your child's neck. Now the area you're going for lies along the large muscle called the sternocleidomastoid that lies along the front and side of your neck. Using closed fingers or the broad part of your hand or palm, start about 1 inch up from your child's collarbone and stroke downward gently 5 to 10 times. Now move up 1 inch, so you're about 2 inches above the collarbone, and repeat the downward stroking 5 to 10 times. You're going to repeat these movements, moving up slowly and gently, 1 inch at a time, until your strokes begin underneath your child's jawline. Now you're making long strokes all the way down the muscle. Always begin at the bottom and work your way up, using downward motions rather than beginning at the top and working down. This is so you're clearing the way for fluid to drain, one step at a time. Once the lymph vessels are clear, it is going to be easier for the fluid around the ear to descend, which can get rid of a lot of the pressure that causes your child's pain. A third technique you can try if your child has an earache is going to be good for many childhood ailments, so remember it. We call it spinal rolling. Have your child lie down on his or her stomach. They can leave their top on or take it off however they feel the most comfortable. If they take their shirt off, you might want to rub some oil or lotion onto your hands and their back to avoid any chafing. Start at the top of the neck and firmly but gently grab the skin and muscle at the base of their neck as though you are gently about to knead some dough. Rolling your fingers forward toward you, gently work your hands all the way down your child's spine, continuing the grab, roll, and release. Repeat this process at least 3 times going downward. If your child finds this technique in any way uncomfortable, you can also take the pads of your fingers and just massage down the sides of your child's spine, about 1 inch to 1.5 inches away from the spine. In acupuncture, this still hits points corresponding to every organ system in the body. Also, feel free to do your own combination of the 2 techniques and take some time with it if your child is finding it relaxing. My son enjoys it for about 10 minutes. Some of my clients like their parents to do this every night before they go to bed. It is great for their immune system, so that's up to you. Spinal rolling and spinal massage serve the really nice and important function of relaxing your child. They also stimulate your child's central nervous system. All organs in the body connect up to the nerves exiting your spinal cord. So in essence, what we're doing is stimulating every organ in the body to function optimally. Additionally, you're encouraging lymphatic flow. Finally, this technique accomplishes a lot. You're affecting your child's autonomic nervous system, the system in your body that's responsible for a lot of automatic functions, including immune response and mucus production. In my experience, the results of these techniques are maximized by consistency. Just 5 to 10 minutes daily can make a huge difference. Just for you as a parent to know, the severity of your child's ear infection does not necessarily correspond to the level of pain that your child is experiencing. Sometimes earaches are extremely painful when the ear is only mildly inflamed. And sometimes a severe ear infection can go almost unnoticed. If your child is under the age of 3, teething is another possibility for what's causing the pain in your child's ear. If your child suffers from chronic or repeated ear infections, absolutely try these techniques. You may also want to check out the chronic conditions section of DVD 2, where we discuss ear infections more in depth.